Hello and welcome to all on SSPC YouTube channel, Ahmedabad. Myself Dr. Disha Dalal and I am a lecturer at Shree Swaminarayan Physiotherapy College. So today we are going to learn about what is learn non-use phenomena. Right. But before we start the lecture, I would like to request all the viewers please to subscribe, like and share our YouTube channel. Okay, so moving ahead, to understand this phenomena, we are going to take an example of hemiplegic patient here. Okay, so we all know about what is hemiplegia, what is stroke, what is the pathology behind it, right? We see that our patient who come to us ask us a lot of questions. They ask us, will I be able to wear my shirt again? Will I be able to wear my pants again? Or will I be able to eat with affected hand? And can I drive my bike again? Right. So the first thing that we need to understand if we need to address these problems is, do patients really use their affected limb? Right. Because we know the stroke survivor have physical dysfunction of arm, right? And there could be a mild, moderate and severe dysfunction. And in severe physical dysfunction is something where the patient is unable to move his or her arm, sometimes not able to open his finger, right? But what about the other patient who are lift the arm, open their fingers? Do they use? It has been found out that more than 50% of the people who suffered with stroke do not use their arm for any activities despite them having ability in their arms, right? So what is the root cause of this phenomena? It is learn non-use. Okay, so we are going to understand using a model that what is the learn non-use during the early stage after neural lesion, right? Okay, when the patient is discharged from the hospital and returns to his home, he start rethinking about how to live his life back, right? He thinks about how will I do my activities, for example, how would I eat food, or how to go to job, or how to drive, etc. If you look in the slide, the center portion that we have hierarchy of needs, and that is attempts ADL. Okay, now they face a problem here. At one end they have a normal side. You can see the left side of the slide. They have a normal side where when they try to do activities they can do it, okay? And whereas at the other end, the other side through which they were doing most of the activities previously, and now with the same side they are not able to do it again. Okay, that is affected side. So what happens here? So look into the left side of the table of the slide about the normal side, right? When patient attempts they get successful, and when they are successful they are more positively motivated to do. For example, they try to take a glass of water and drink water when they are thirsty, okay? On the other side, now right side of the panel, right side of the slide, the affected side, patient arm is affected with sensory, motor and other problems. Now when he tries to lift the same glass of water, what happens? He is unsuccessful. And we see that patient that tries to lift the glass of water and water spills off. Okay. So now patient attempts again and again, and the water spills. So he start getting demotivated in using the affected side, right? Now this is what happens in the earlier stage. Okay. So now as time goes on, what happens? When the patient tries to keep doing the activities as day after day, many attempts, although there are some improvement happening on the affected side. Okay, there are improvement but very little, very minimal. It is not enough for him to complete doing the activity, and so he start to stop the use of affected side, and this is called as learn non-use. It means that he learns not to use the affected side. What happens, he start compensating to use another hand, normal hand, in order to perform. Let me give you one example here. When we are dressing on and putting a button, we normally put it with both the hands, and that's the normal way of doing it, right? But when a patient attempts, he completes the whole activity with one hand, and that is his normal side. So, for example, so if he wants to go out immediately, and what he does, he start wearing his shirt, and it takes a lot of time with the affected side, right? So he start doing it with the unaffected side, and it takes a lesser time, and then he continues to do this practice throughout the day and day after day. Okay, so this also leads to some additional secondary changes in the affected side, like there will be a lot of tightness, they start getting pain because of not using the arm. Okay, so this is learn non-use phenomena is not something which happens outside. It also start producing quantitative changes in brain. Okay, so this is all about learn non-use phenomena. If you have any doubt, you can just mail me on this ID. And thank you so much for listening. Please do like and subscribe our YouTube channel for more update. Stay safe, stay healthy.